Welcome back to another episode of HealthCap Weekly Wrap. This week we're covering new CMS administrative standards, a federal look at Medicaid fraud enforcement outcomes, a Michigan-based leadership and QAPI initiative, CDC guidance on waterborne outbreaks, evolving expectations around antipsychotic use, and new research on how administrative compliance impacts outcomes after disasters.
All right, let's jump in.
So I'll start us off with CMS. This comes from cms.gov, their fact sheet on administrative simplification, and the adoption of standards for healthcare claims attachments.
Oh, yeah, I saw that. That sounds kind of technical. Why should people in senior care pay attention to that?
Yeah, it does sound a little dry at first, but it actually matters a lot. What CMS is doing here is standardizing how claims attachments are submitted. Think documentation that supports billing, like clinical notes or discharge summaries. Right now, that process can be really inconsistent and manual.
Okay, so like faxing things, emailing, uploading in different formats?
Exactly, yeah, a lot of variation. And that creates delays in reimbursement and more administrative work. CMS is trying to fix that with uniform electronic standards.
Oh, that's big. Because I feel like billing delays are one of those hidden stressors in communities.
Totally. For senior care communities, especially those with tight margins, faster and more predictable reimbursement is huge. Less staff time spent chasing paperwork and more focus on resident care.
So, what's the takeaway for listeners?
I'd say start preparing your billing and IT teams. Even if implementation feels far off, understanding these standards early will help you transition more smoothly. And long term, this should reduce administrative burden, which is something everyone wants.
All right, shifting gears a bit. This is from the HHS Office of Inspector General, Report OEI 09 26 00140. And this one is about Medicaid Fraud Control Units.
Okay, enforcement side of things. What's new there?
So this isn't really identifying problems like some OIG reports. It's more of a data snapshot. It shows how these units are performing. We're talking about things like convictions, recoveries, and return on investment.
Oh, interesting. So more like, here's what's happening, here's the impact.
Exactly. And what stands out is that these units continue to generate significant recoveries relative to what's spent on them. So there's strong federal interest in keeping these programs effective.
How does that translate to senior care communities?
Yeah, good question. It reinforces that oversight isn't going anywhere. If anything, it's becoming more data driven. Communities need strong compliance programs, not just to avoid penalties, but to align with this broader accountability push.
Right, it's not just about avoiding risk, it's about demonstrating integrity.
Exactly. And I think one practical takeaway is making sure documentation and internal audits are solid, because these enforcement trends show that regulators are paying close attention to how funds are used.
All right, let's move into something more operational. This next one is actually a really interesting video from the Moving Forward Nursing Home Quality Coalition, focused on a Michigan initiative around leadership and QAPI.
Oh, I loved this one. There's a lot to unpack there.
So this was a multi-year project in Michigan involving multiple senior care communities, focused on strengthening leadership and embedding QAPI practices. QAPI, of course, being quality assurance and performance improvement.
Right? Required by CMS, but often feels like a checkbox.
Exactly. And what's different here is they made it practical. They paired leadership training with real performance improvement projects and added coaching support.
That coaching piece stood out to me.
Yeah, same. Coaches weren't there to critique, they were there to support. And it created this environment where staff felt comfortable asking questions and trying new approaches.
And they had real results, right?
They did. One example they shared was a community reducing hospitalizations from about 60% down to 22%. That's significant.
Wow, that's not just a small improvement.
No, that's transformative. They also saw reductions in UTIs, improved staff confidence, and better teamwork.
So, what made it work?
A few things. Short practical training sessions, inclusion of frontline staff, not just leadership, and letting communities choose improvement projects that mattered to them.
That makes sense. People are more engaged when it's relevant.
Exactly. And they emphasize this idea that QAPI isn't just a monthly meeting, it's something everyone in the building participates in.
That's a culture shift.
It is. And for listeners, I think the takeaway is that meaningful improvement comes from combining leadership development with hands-on support. Not just policies, but practice.
All right, next up, let's talk about CDC guidance. This one is from the CDC on waterborne pathogen outbreak investigation and response.
Okay, this sounds very clinical.
It is, but it's really important. This document focuses specifically on how to investigate and respond to outbreaks linked to water systems. So, not just identifying a pathogen, but figuring out where it came from and how to stop it.
Oh, so more like root cause analysis plus response.
Exactly. It walks through strategies for environmental testing, assessing water systems, and implementing control measures.
Why should senior care communities care about this?
Because water systems in these communities can be complex, and residents are often more vulnerable to infections like Legionella. If there's an outbreak, you need a clear process to investigate and respond.
Right, you can't just react. You need a plan.
Exactly. And this guidance helps communities think through that plan ahead of time. What data to collect, how to coordinate with public health, how to communicate internally.
Is this a newer document?
It's been around for a bit, so not brand new, but still very relevant, especially as we continue to see cases of waterborne illnesses in healthcare settings.
So, takeaway?
Make sure your emergency preparedness and infection prevention teams are familiar with this type of guidance. And if you don't already have a water management program, this is a reminder to build one.
All right, let's talk about antipsychotics. This one comes from McKnight's Long-Term Care News.
Yeah, this is a big topic right now.
It is. The article talks about increasing pressure from CMS around antipsychotic use in senior care communities.
We've been hearing about that for a while, but it feels like it's ramping up.
It is. CMS is pushing for reduced use, especially when it's not clinically justified. There's more scrutiny, more expectations, and more focus on non-pharmacological intervention.
So communities can't rely on medications as much.
Exactly. And that's where it gets challenging, because managing behaviors without medications takes more staff training, more time, and more individualized approaches.
Yeah, it's not a simple switch.
Not at all. The article highlights that providers need to document thoroughly and demonstrate that they've tried other interventions first.
What kind of interventions are we talking about?
Things like personalized care plans, environmental adjustments, and behavioral strategies. Really understanding the root cause of behaviors.
So, again, kind of like that QAPI mindset we talked about earlier.
Exactly, it all connects. And the takeaway here is that communities need to be proactive, review prescribing practices, train staff, and make sure documentation tells the full story.
All right, let's wrap with the BMJ Public Health study. This one looks at administrative compliance and post disaster outcomes in nursing homes.
Yeah, this one's fascinating. The study analyzes how compliance with administrative regulations correlates with outcomes after disasters.
Oh, like hurricanes, things like that?
Exactly, and what they found is that communities with higher levels of administrative compliance tended to have better outcomes, lower mortality, better continuity of care.
That's interesting. You don't always think of compliance as tied to disaster resilience.
Right, it can feel like paperwork, but this study suggests it's actually a marker of organizational strength.
So if you're good at compliance, you're probably good at other systems too.
Exactly. Documentation, communication, leadership, all of those things contribute to how well a community responds in a crisis.
So what's the takeaway for listeners?
Don't think of compliance as just regulatory burden. It can actually be an indicator of how prepared your community is for unexpected events. Strengthening those systems can improve both everyday care and crisis response.
Yeah, that reframes it a bit.
It really does.
All right, that's a great place to wrap up.
Thanks for joining us on this week's episode. As always, these stories highlight the connection between regulation, operations, and resident outcomes in senior care.
And if you want to dive deeper into any of these topics, be sure to check out Angie's blog at healthcapusa.com/Angie's-blog.
Thanks for listening, and we'll see you next week.